The secret to a strong core is not working out. You heard that right. Working out is not going to give you a strong core. People can have six-pack ab muscles and have really, really weak cores. So having six-pack abs is more attributed to having like a really lean body mass. It doesn't mean that your core is super functional or that it's very strong at all, okay? So having a strong core, it actually doesn't even take doing a ton of exercises or working out. Now, yes, are there exercises that can help improve your core? 100%, but there is a lot of other ways to improve your core function, and we're gonna talk about that today. My name is Dr. Allison. I'm the owner of Body Motion Physical Therapy in Edmonds, Washington, and we help people through fertility, pregnancy, postpartum, and through menopause. So we help women have really strong cores so they can help reduce the amount of joint replacements, joint injections, bladder surgeries, you name it. All that stuff that a lot of people get as they get older can really be prevented if we have really strong cores that support our joints and support our bladders and our pelvic organs. And so we're going to talk about what that even means today and why it actually doesn't even take exercise to have a strong core. All right? Let's get into the first thing. The very first topic is core pressure. So having a strong core means that you have established really good, strong pressure, good, strong core pressure. So if you imagine pressure, when we talk about the pressure system of a strong core, if I like to use Mary Massery's example of a soda pop can, okay? A soda pop can that is not, where the lid is not popped, the top is not popped open, has really good pressure. So it's harder to squish the can. If you open the can, you lose that really good internal pressure. And so it's easier to squish the can. Well, if you're pregnant, or you have an abdominal surgery, or you have a vaginal delivery, you lose that integrity of the core pressure. And so part of rebuilding postpartum is to build that back, redevelop your core pressure system and get everything balanced so that you have a really solid foundation so you can't squish the can. Meaning that your joints aren't getting smushed, meaning that your organs aren't getting smushed out of your body, meaning that everything is staying in the right places and the core is supporting that, okay? The core is really important, and in order to have good core pressure, you actually don't have to do exercises. There is just simple ways that you can start utilizing your breath to help establish really good core mechanics, all right? And it's actually a little different for females than it is for males. Now, intra-abdominal pressure is the same, but once you've had babies, or once we've gone through pregnancy, our organs tend to be a little heavier and can droop a little bit more in our bodies. So if you imagine that your uterus is sitting on top of your bladder and that uterus just grew really big and then it pushed the baby out, and maybe you pushed for a long, long time. And if you had to go through that pushing phase that was very long, maybe you pushed your bladder down a little bit. So it's normal, it's not normal, but very common for a lot of these pelvic organs to be extremely descended after childbirth. And we want to help them go back home and go into their places. And helping manage your core pressure is actually going to help them go back into their appropriate places. You can assume your core pressure is off if you have low back pain, if you feel a heaviness in your pelvis, if you feel that you're peeing your pants, or any kind of pelvic symptoms. Usually core pressure is affected when it comes to having those kinds of symptoms. So it's really great to work with a pelvic expert physical therapist to help manage those symptoms, but it's also really, really important that okay, my core might not be working for me the way it should, or I work out all the time. How come my core still feels super weak? So let's talk about that. If your core feels super weak, then you'll have an idea that, hey, I need to strengthen my core. So now let's get into tips for strengthening your core and or managing your pressure so that your core feels stronger. So again, not simple just simple breathing tips, but they don't have to be necessarily exercises. Of course, core exercises work and they can be great, but they might not be enough, and really establishing your core pressure is what's gonna help improve your core system as a whole. And we want the core to be strong enough that you don't feel like you have to engage every muscle just to stand up tall or to sit up tall. We we want that to feel like I can naturally rest on my skeleton in a sitting position without having to really work for it, okay? So you want your core to be strong so it can support your skeleton, but you shouldn't feel like you have to constantly contract it to sit up tall. Like I'm resting on my sit bones here, my skeleton is stacked on top of each other. I can relax everything in my body in this position, and my skeleton is doing the work. So for the core, yes, my core is strong enough that it can support this, but it's not constantly turned on or tightening in order to hold this position, okay? So how do we start to manage our core pressure? Well, we're gonna talk about breath, all right? So breathing and how you breathe with movement can help improve your core pressure. So when you inhale, that increases your core pressure, and you exhale, that decreases your core pressure. You can inhale again. On the exhale, you're going to use the SH sound, a shh sound, and you might feel your lower abdominals kick on with that, and that's great. That is activating your lower abdominal muscles with the exhale, but your breath is driving that core activation. So again, inhaling and exhaling, decreasing core pressure, increasing core pressure, decreasing core pressure, increasing core pressure. That is core pressure, and that is what we're going to talk about. As females, we want to help decrease our core pressure to help take pressure off of our pelvic organs, like our bladders, our rectums, and our uteruses, and our uteri, so we can keep them in the right places and not put pressure on them and descend them when we're doing anything with exertion. So, and this holds true for most cases. There might be some times where you reverse the breath patterns. But for example, if I was going to do a squat, or even if I'm simply just going from sitting to standing, I would initiate my sit to stand with a shh, exhale, and inhale on the way down. Shh, exhale, and inhale on the way down. And that is automatically going to turn my core on and help decrease my intra-abdominal pressure, which helps my core have a tighter contraction. So using the exhale is going to help get that natural core stability. Now, if we talk about using, not having to use exercises, just using your breath to help get that great core strength, then that is managing your intra-abdominal pressure. So when you're going through life and you're managing your intra-abdominal pressure, using the breath is going to be essential for using your core. And again, for females, it can look a little different. Females have to keep their pelvic organs inside their bodies. Men, not so much. They get it outside of their bodies, so they're not worried about prolapsing their organs or getting descent of their pelvic organs. Females, it's a different situation. Females have to keep these organs inside their bodies, and at the same time, they're pushing babies out, right? So that's why that descent can be so common. So we want to talk about decreasing the pressure, using your breath with movement, any exertion, any weight, any movement that takes effort, and using the exhale with exertion to help solidify and bring that core together. And so here, all you're doing is using the breath to get the core activated. There is another way that people will use core pressure and this is taught a lot in powerlifting and Olympic lifting, is if I was going to do a squat or a deadlift, I inhale, squat, and then exhale at the top. So they inhale, they increase their core pressure to get even more stability, go through the movement, and then exhale. So that is appropriate for like a power lifter or an Olympic lifter to use the breath to create an abdominal brace. But because as females who've had babies, we want to work on keeping everything up and inside of our body. If we increase the pressure as we do a movement, we're going to get more downward force on the pelvic organs, decreasing the effectiveness of our core. So yes, you're increasing the pressure to get a core brace, but you're not optimizing the downward pressure, and it's going to put a lot more strain on the pelvic floor. And so it's really important that you start to think about these things. And if a powerlifting and Olympic lifting is super important to you after having babies, that's fantastic. And maybe you can learn to PR with bracing and getting your strength on the exhale, okay? So if you're competing, that might be a different situation. You might have to go on the inhale, but if you're not, then always work on driving the movement with the exhale so that you can help decrease the pressure on those pelvic organs. And then simply, that is core strength, using the core pressure to maintain and develop your core strength. Now, if we don't have this type of core pressure, or we don't know how to utilize this type of core pressure, this is where things like low back pain or disc herniations become really common, because the increase in abdominal pressure as we do something that is increasing pressure on our spine can just predispose us to more injuries like disc herniations, pelvic organ prolapses, bladder issues, you name it. So it's really important that we do manage our core pressures. And again, you can do this without exercise. It's simply just this breath tip that we went over here that helps keep these pelvic organs in check, helps get your natural core stability. And this is all without you doing exercises. And this is one of the secrets to having a super strong core. There's a little bit more in regards to developing relaxation techniques with the pelvic floor so that you know you have range of motion in the pelvic floor, but we go over that in another video, so you can check that video out and I'll link it here in the show notes. But for today, what we're talking about is core pressure, maintaining a good strong core without exercise.